This video will teach you how to do a trach tube change on a child with a tracheostomy tube. Trach tube changes should be completed once per week or as needed to prevent infection, buildup of skin tissue, or mucus accumulation. It is recommended that 2 caregivers be present during routine trach tube changes. However, you must be able to change a trach tube independently in the event of an emergency. Supplies needed: rolled towel or blanket, same size trach tube with ties already attached, obturator, water-soluble lubricant, dressing if used beneath the trach tube. Emergency equipment includes downsized tracheostomy tube, ambu bag with oxygen, and suction. Before starting, make sure your child is connected to their pulse oximeter. Wash your hands, and then place all emergency trach supplies within reach. If not already done, attach the trach ties to a clean trach tube, being careful not to touch the cannula. Inspect the trach tube for any visible damage, and inflate the cuff to check for leaks. Insert the obturator and then place a small amount of lubricant on the outside of the cannula. Then place the tracheostomy tube within easy reach. Lay the child flat. You may want to place a rolled towel or blanket under the shoulders to see the trach site more clearly. Consider restraining the child's arms with a towel or blanket. Okay. Consider suctioning the trach tube before changing the cannula. If a dressing is at the trach site, remove it at this time. Secure the trach tube at the flange or wings with 2 fingers. Remember to keep 2 fingers securely holding the trach tube in place until you are ready to remove it. Disconnect the Velcro at the back of the neck if using a 2-piece trach tie. If using a 1-piece trach tie, remove 1 Velcro attachment and remove one side of the trach tie from the trach tube wing and bring the tie out from behind the neck. Remove the trach tube and place it to the side. Pick up and insert the new trach tube. Secure it with 2 fingers and remove the obturator. If the child is on oxygen or a ventilator, reattach it to the trach tube at this time. Attach the Velcro at the back of the neck if using a 2-piece trach tie. If using a 1-piece trach tie, gently bring the trach tie around the back of the neck to the other side. Pull the Velcro attachment of the trach tie through the trach tube wing with the sticky side facing away from the skin. Secure the Velcro attachment to the trach tie. Take care not to pinch the skin where the trach tube and trach tie meet. While continuing to hold the trach tube in place with 2 fingers, use the other hand to check the fit of the trach tie. 1 finger should easily fit between the trach tie and the neck. If necessary, adjust the tie to the proper fit. Remember to keep 2 fingers on the trach tube while adjusting the tie. Once the fit of the trach tie is correct and the trach tube is securely in place, you can release the trach tube. You may choose to trim the trach tie with scissors. Consider performing your daily skincare at this time. If your trach tubes are reusable, you will then want to gently remove any secretions from the trach tube that you just removed and clean per the manufacturing instructions.